Well, good afternoon, everyone. Thank you for being here. I want to especially thank all the folks who are standing with me this afternoon as we announce this important initiative to combat illegal prescribing and dispensing of prescription drugs here in this state. Joining me here today, and I'm so pleased, are State Auditor Suzanne Bump, First Assistant U.S. Attorney John McNeil from the U.S. Attorney's Office, and I want to especially thank Carmen Ortiz and her focus and work on this and many other issues. Special Agent in Charge Harold Shaw of the FBI Boston Division. Special Agent in Charge Michael Ferguson of the DEA's New England Field Office. Special Agent in Charge Philip Coyne of the U.S. Department of Health and Human Services Office of the Inspector General. Michael Summers, Assistant General Counsel at the Massachusetts Executive Office of Health and Human Services. I also want to especially thank and acknowledge District Attorney Michael Morrissey, whose efforts to get agencies together in Norfolk County to review overdose deaths every quarter also helped inspire the formation of this effort in this kind of interagency collaboration and working group. Look, we all know that we are in the midst of a terrible crisis. Heroin deaths, opioid deaths, addiction ravaging families and communities across this state. And you know how committed we are to addressing this issue across a number of fronts. Making treatment more available and easier for people to access, getting the word out about education and prevention, working on issues of making the life-saving medication Narcan available. We have seen in even recent days a devastating spate and uptick in overdoses in communities across this state. Many of those overdoses did not turn into fatalities because of the life-saving Narcan available and through the great work of first responders. We're also taking steps to investigate and bring enforcement actions against those who traffic in deadly drugs, heroin, opioids, and increasingly a new form of very deadly fentanyl that is out there in our state. These are all critical steps. They're important steps. But today we are addressing one particular aspect of this crisis, and that is the problem we have with the proliferation, the overprescribing of dangerous prescription drug medication. Let me just talk to you a little bit about where we have come so that you have some context for the work that we are announcing today. You know, opioid prescribing has grown exponentially since the mid-1990s by 140%. I want to repeat that. Opioid prescribing in the United States has increased 140% since the mid to late 1990s. In Massachusetts alone last year, there were 4.6 million prescriptions for opioids. 4.6 million prescriptions for opioids in this state last year alone. Nearly enough for every adult and child in this state to have a bottle of their own prescription pain medication. As a country, the United States is 5% of the world's population, but we consume 80% of the world's opioid supply. And unfortunately, what we've seen over the last 15 years is that as the number of prescriptions have increased, so too have the number of overdoses and addictions. And we are paying the price for that right now here in communities across our state, and indeed this is a national issue. Now, as bad and as deadly as heroin and fentanyl are, and we have seen the problems particularly lately with heroin and fentanyl, and so many people are in need of help and treatment and intervention here in our state, I want to remind folks that as significant the number is in terms of the number of folks who are addicted to heroin, using heroin, 3 times as many Americans are addicted to prescription pain medication. 3 times as many Americans are addicted to prescription pain medication, opioid dependent. Opioid dependent in a way that is unhealthy for them, unhealthy for their families, unhealthy for our communities. This is simply an unsustainable situation. We need strong action, and we need it now. And that's why we are all gathered here today. Let me also say at the outset that I recognize and understand that the vast majority of prescribers across this state are doing the right thing, are taking care of their patients, are serving those in need. There are also a number of folks who are in need of access to pain medication. This working group is not about them. This working group is about the fact that we do have actors out there in our state who are illegally, unlawfully prescribing prescription pain medication. And that is causing great harm. Just last month, we charged a doctor for illegally prescribing opioids to patients who had documented substance use problems, including allegedly continuing to prescribe fentanyl and oxycodone to a patient who in the recent past overdosed on fentanyl. The Interagency Group on Illegal Prescribing will bring together all federal and state law enforcement partners who are responsible for investigating the illegal prescribing of opioids. The heroin and opioid epidemic is too large and too urgent a problem to let red tape or bureaucracy get in the way. The fact of the matter is, all of our agencies have investigative tools at our disposal and look at and review information related to the prescribing and dispensing of opioids. Now, for the first time, we're going to make a concerted effort to work together, to share information, to share data. And that's going to lead to more prosecutions, more investigations, and ultimately the end to illegal and unlawful prescribing practices in this state. It's about saving lives. It's about protecting the health and welfare of folks here in this state. That's what this interagency group is about. We will meet regularly to collaborate on ongoing investigations, share data patterns and trends, and formulate strategies to better address illegal prescribing and dispensing activity. We will investigate those who prescribe opioids for patients already struggling with substance use issues, or who prescribe in extremely high amounts for patients with no legitimate medical purpose. We know that there have been instances where prescribers have prescribed to dead people. We know that there have been instances where prescribers have prescribed the so-called holy trinity of drugs, benzodiazepine, oxycodone, and sleep aid and sleep enhancement medication. This is dangerous stuff. It's dangerous to the patients, dangerous to those who are receiving or have access to this medication. And so this is about helping them, protecting public safety, protecting public health. We're going to work collectively to maximize our state and federal resources by ensuring, first of all, that we're not duplicating efforts, that we're effectively utilizing the information at the disposal of each of our agencies, and that we're making the appropriate referrals for prosecution and enforcement. I want to remind you this is one step, just one step, but it's an important step. And I'm proud to stand with these partners. I know that they are committed, as we are, to doing everything we can to take steps to help people, to save lives, and to turn the tide in this deadly epidemic we are facing here in Massachusetts. This group is about changing some of the culture, changing the practices around prescribing, and doing so in a way that will save lives. At this time, I'd like to ask Auditor Bump to step forward. Months ago, Auditor Bump and I had a conversation about how we could better coordinate and share information, and I am grateful to her for that discussion and look forward to our teams working together to this better end. Auditor Bump, thank you very much.
Thank you, General Healy, for those remarks and also for your role in galvanizing both public and government activity and directing it towards this scourge. I appreciate your efforts and those of all the individuals here today as we launch this new undertaking to address the problem of opioid overprescribers in the Commonwealth. In my private life, I've been invested in this issue for many years through family members and friends who are active in the recovery community, as a co-founder and director of a nonprofit that provides drug recovery services to women in the city of Brockton. I know how insidious this addiction is, how difficult recovery is and how many of us in government have tools that we have to put to work in order to fight this scourge. So I'm here, I'm sure that many of you are surprised to see the auditor trying to make a contribution in this effort, but I'm here because the state auditor's office actually possesses some of the tools that are going to be helpful, and I want to put them in service to this cause. We have in our office a growing capacity to collect and analyze data that will complement the efforts of the other professionals from across government to identify individuals who are contributing to the problem of addiction under the guise of legitimate medical practice. Those efforts that we'll be undertaking alone won't solve this problem. We all know by now that there is no home run solution. But we can make progress by steadily and doggedly collaborating. It's not very sexy, but that's what it takes. Steady and dogged collaboration to take down the enablers of addiction. I want to thank you all once again for being here, and I look forward to making productive contributions to this effort. Thank you.
Thank you very much, Auditor Bump, and we look forward to working with you. I also want to acknowledge folks in our Medicaid Fraud Division, in particular my chief, George Zakos, and Kevin Reddy, Chief of Investigations, who will continue to be integral in this effort, and look forward to working with the auditor and her teams and the teams of my colleagues on this effort beginning this afternoon. Now at this time, I'd like to call forward the Special Agent in Charge for the FBI Boston Division, Harold Shaw.
Thank you, Attorney General Healy, and we appreciate your leadership in bringing us together as part of this interagency working group. As you know, there's been an unprecedented amount of high-quality, low-cost heroin and other opioids flooding our neighborhoods. There have been record numbers of overdoses, resulting in deaths and life-threatening addictions. This is not only a public health issue, but a public safety problem. The FBI is committed to a multifaceted approach to disrupt this illegal drug prescribing, as well as distribution networks supporting the movement of these opioids. The FBI is uniquely situated and positioned to support this interagency group. First, through leveraging of our healthcare task force. We've had years of experience investigating and dismantling sophisticated frauds within the healthcare industry. We've focused some of these efforts, specifically within our task force, to identify schemes and frauds leading to the overprescription of opioids, ultimately resulting in serious death, or harm to our patients. We will also continue to identify the medical providers who are involved with fraudulent billing practices. We'll use these partnerships not only to share critical intelligence, but to augment investigations by providing FBI resources and leveraging the greater investigative body. Secondly, we'll continue to identify and investigate violent or organized crime networks directly involved with the distribution of these opioids. Working in conjunction with our federal, state, and local partners, we will not only look to enhance this coalition, but actively work to develop cases against healthcare professionals or criminal networks contributing to this epidemic. Thank you, Attorney General.
Thank you very much, and we really appreciate the support of our federal partners. As we know, this is not just a Massachusetts issue or a Northeast region issue. This is an issue that is indeed affecting families and communities across this country. And so it's exactly for that reason that the state, federal, and local partnership is where we've got to be, and that's what this is about. At this time, I'd like to invite forward Special Agent in Charge Michael Ferguson of the New England DEA.
Thank you. Good afternoon, everyone. I'm pleased to stand here today with our law enforcement partners and our regulatory partners to announce the formation of this new coalition to combat the opioid epidemic. I want to thank Attorney General Healy for bringing us all together here today. This coalition will bring together the resources, the investigative expertise, and the intelligence information from each of the law enforcement and regulatory agencies here today. While the overwhelming majority of doctors, physician assistants, nurse practitioners, dentists, pharmacists, pharmacies and hospitals are doing their jobs responsibly, as the Attorney General mentioned earlier, our focus and attention will be on those medical physicians, practitioners, and pharmacies that are acting irresponsibly, that are contributing to the illegal diversion and availability of pain medications on the streets of the Commonwealth. DEA will utilize every enforcement, administrative, and civil tool possible to investigate the most egregious violators. DEA registrants, to include doctors, dentists, and pharmacies, are responsible to handle controlled substances in compliance with the Controlled Substances Act. The diversion of prescription pain medications contributes to the widespread abuse of prescription opioids, which is the gateway to heroin addiction and is devastating our communities. We know that 4 out of 5 of new heroin users were addicted to pain medications before they made the switch to heroin. Law enforcement has an obligation to improve public safety and public health, and DEA is committed to working with our law enforcement partners standing here with me today to ensure that both state and federal laws and regulations are followed. In fact, DEA has more investigators working on prescription drug diversion and heroin cases than at any time in our agency's history. Thank you.
Thank you very much, Special Agent Ferguson. At this time, I'd like to invite to the podium Special Agent in Charge Phil Coyne of the United States Department of Health and Human Service, Office of Inspector General. Phil, thank you.
Good afternoon. My name is Phil Coyne, and I'm the Special Agent in charge of the U.S. Department of Health and Human Services, Office of Inspector General. I'm very proud to be here today because the mission of this coalition is in perfect alignment with the mission of HHS-OIG. Our mission is to protect the integrity of HHS-funded programs as well as the beneficiaries served by those programs. Our two biggest programs that we oversee to keep safe from fraud, waste, and abuse are Medicare and Medicaid. Medicare is an insurance program for people over 65 as well as disabled. Medicaid is a partnership between the state and the federal government for people who need health insurance. And it's appalling that the public doesn't realize this, that some of these federally funded health care programs are actually contributing to this opiate epidemic. We stand together with this coalition to make sure that Medicare and Medicaid dollars are spent appropriately on legitimate medical services. Just to put into perspective, when Medicare passed the Prescription Drug Act in 2006, nationwide, we paid $51 billion for Medicare prescriptions. In 2014, that number has risen 136%. In 2014, the Medicare program paid $121 billion for prescription drugs. My office oversees the payment of these drugs to make sure that they're appropriate and medically necessary and for legitimate medical purposes. More relevant to today's discussion, of that $121 billion in prescription drugs that were paid for by Medicare last year, $7.8 billion were paid for opiates. And that number just keeps growing and growing and growing with overprescribing. We've seen similar growth in the mass Medicaid program. At last check, the mass Medicaid program has paid over $10 million for opiates. As our previous speakers have said, we can't say that the vast majority of these prescriptions are for legitimate needs, but some of them are fraudulent. Some of these drugs are being diverted. Some of these prescriptions are being used for drug trafficking, and as Zach Ferguson said, it's a known gateway to heroin. In this coalition, my investigators will work hand in hand with our federal and state partners to make sure that all federal health care dollars are spent appropriately. Furthermore, I want to let the public know that any health care provider who's participating in federally funded programs, Medicare and Medicaid, that's found guilty of health care fraud or illegally prescribing opiates will not only be prosecuted and investigated, but will also be excluded under the HHS OIG Exclusion Authority. And once you're excluded from federal health care programs, you cannot work in the health care arena. Thank you.
Thank you very much, Special Agent in Charge Coyne. At this time, I invite any questions.